Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
So I've been having back pains for many years, probably for too much playing tennis and soccer. I do have arthritis. I know that in all of my joints, surgeries in different places, but it's progressively getting worse every year. In winter time, it gets really painful and locks up quite often. If I stand up too much or I sit down too much, it locks up. And I have to do a lot of stretching, a lot of inversions and
So you do inversion
decompression to relieve that pain. Because sometimes I can't even walk straight. I can't keep my back. It just
so you're walking like forward.
Back.
So how many years have you been experiencing back pain?
I would say at least 20 years.
20 years. So for the 20 years, what kind of treatment, who doctor you saw, and what the recommendation?
I've seen plenty of doctors. Usually they give me anti-inflammatory to relieve the inflammation, and also sometimes painkillers if it gets too bad. I try to use again inversion table, and I've seen some specialists. They've taken MRIs, X-rays, the whole thing.
What they found?
They found a bulging herniated disc.
What level?
Between L4 and 5.
Okay.
That requires surgery to relieve the pain.
So they recommend surgery. How many surgeons recommend surgery?
3 of them.
Oh, so you went to 3 surgeons and all the 3 recommended surgery.
They all did, and one of them told me, listen, if you can take the pain, I wouldn't do the surgery because there's no 100% relief. You know, it might not be 100% effective.
Nobody guarantees 100% effective.
Exactly.
Yeah. So current symptoms, what kind of symptoms do you experience? Do you have sharp shooting pain to your legs?
Now that the weather is getting warmer, it's not as painful. It's more stiffness in the morning. But in the winter time, when these pains come, I have shooting pain down my left side, sometimes numbness. Sometimes I can't even feel my foot. I can't walk, put any weight on it, or it just gives away. And sometimes I have shooting pains right down my leg, and even tingling sensations. And
you feel it in the whole lower extremity, or you feel it in your feet?
It starts from here, from the side, all the way, especially here in the hip. That 90% of it is probably in the hip, and then it starts shooting down sometimes.
So how much pain from 0 to 10? 10 is emergency or much worse?
When I have the sharp pains, it's probably 8, 8.5.
What about now?
Now it's probably maybe 1.5, 2.
So we're gonna do the motion that aggravate your symptoms. So you let me know how much pain with those motion. So you said standing, we'll have you stand up and we'll have you bend. We'll have you stand up. I want you to bend forward, reach to the floor. And tell me, and mark on your legs how far you can go. So really touch your legs. So you mid.
Knees locked?
Yeah. How much pain from 0 to 10?
Probably 3.
Backward.
It's my hamstrings.
Hamstring are tight. Yeah.
Very tight. Left side. Right there.
How much from 0 to 10?
About 2.5.
2.5.
2.5, 3.
So twist left and right. That side bend.
There's some pain there, about 3.
And the other side. Do you have sharp shooting pain or just localized in the back now?
Just localized in the back right now. That's
in the morning you said, or when it's cold, you start to have the sharp shooting pain. Twist.
Some, about 1. Not bad at all.
So I'm gonna have you do squats and tell me how that feels.
Squats.
So you're gonna bend your knee and try to go down. How's that? And up.
On the back, it's not bad. It's my knees that hurt.
And your knees that hurt. So the worst motion was like forward and twisting. Have you had any abdominal surgery?
No.
Sorry if I pulled your finger.
It's okay.
Make sure you breathe, So it's all around this area. How does it feel?
It's good.
Okay. You feel this knot here. That one. Feel that?
Yeah.
Is that painful?
It's not painful, but I definitely feel it.
Yeah.
It's
You have like a little rock
not
here.
painful. Yeah.
Yeah, make sure it's not too much what I'm doing, okay? Because I want to know if you have inflammation, and I don't want to cause inflammation. So if you feel pain with the treatment and we push the pain, that might cause inflammation and make it worse.
Yeah.
We don't want that. We want to just work on the proliferation stage only. Feel that?
Big time.
Sorry. Yeah. Is that too much here?
No, it's fine. I mean, you're right on there on that knot.
You feel that?
Yep.
That's a big one here. Feel that's right in here. Do you guys see this? You see it's jumping here.
Yeah.
Here. It's just stuck. It's not really going a straight line. I'm gonna do it this way. Sorry, is it too much?
No, it's
And you
good
see-
pressure.
You see the redness where he has the scar tissue.
There's still some pain, but
0 to 10?
mild. Maybe 1.5.
Okay,
No pain.
okay.
Some discomfort, but no pain.
How's that? You're going further now. Look at
Much
that.
further. Yeah.
Yeah,
And
it's
there's
a lot
no
more.
pain, just discomfort.
Okay, so let's do this, okay? Because we know you have arthritis there. I'm gonna put the magnet in the back, okay? So, and I will have you do the motion and tell me if your pain gone when you have the magnet. Let's pull this up a little bit. I just want to have the magnet on the spot. Is that on the spot?
Mm-hmm.
Okay. Let's do the motion again and tell me how that
Okay.
feel.
So we're going back.
Yeah. How's that? With the magnet on.
Excellent. No pain, nothing.
Okay, we'll just do the
Not even
side.
discomfort.
Yeah, that's inflammation. That's good. You're going further this way, actually.
No pain.
Okay.
Just discomfort.
Yeah. And we'll have you bend forward. How's that?
Very good.
Can you tell the difference when I put the
Yes.
magnet on it?
A little bit, yes. There's an improvement.
Improvement. So that's the arthritic part that we need to work on with the magnet. That's usually I recommend to wear it for several hours a day, depending on how bad is the inflammation. Right. So you had it for 20 years. Now we just did ASTR treatment. Can you tell any difference?
Major difference.
What's the
My
difference?
flexibility, my pain level, the tightness. It's not as tight anymore. I mean, I have more motion, and it's more like instead of the pain, it's more of a discomfort, tightness.
Just
but,
at the
but I'm
tightness.
much looser. I can
Looser.
feel more flexible.
That's nice. Awesome. Thank you.
Thank you.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.